and go ahead.
Thanks. Good afternoon. I'm Tracy Young. I am one of the community prevention specialists for Carbon County. In honor of Suicide Awareness Month, which is all of September, we're going to talk about a fairly new training that's available in Carbon County and many places across the state. The new training is CALM, Counseling, Conversations, Collaboration on Access to Lethal Means. It's reducing suicide risk through effective means safety. And why another suicide prevention training along with all the other suicide prevention trainings that we have in Wyoming? And the reason is this. I'm going to take you to a website so I can show you maybe. Let me do a new share. I want to show you just some of the data as to why why we talk about suicide so much in Wyoming. One of our, another piece of suicide prevention is the 988 number. You can see one of the Wyoming Department of Health suicide prevention strategies is advertising the 988 lifeline. 988 is, you can text or call the number at any time, and we have 2 places in Wyoming that are answering those calls. So we do actually have Wyoming people answering those phone calls or text messages. So in Wyoming, we talk about suicide so much because historically and currently, we continue to be number 1 in the country. Sometimes we will flip-flop between 1 and 2 with Montana, Alaska, some of our other rural states that we share some similar demographics with. If you look here, our Wyoming line, so in 2022, the suicide rate was 26.3 per 100,000 people. So that's an estimate of 153 suicides in Wyoming in 2022. And that's, and some people ask why 2022, that's 2 years ago. It takes a while for us in Wyoming to get all of our data together. And then if you see here, 14 per 100,000 people in the United States. So that number is almost 46,000 people in the United States completed suicide in 2020. So again, I think we're constantly trying to find ways to prevent suicide and different ways for people to understand what suicide looks like in our state and across the country. As you can see here, these are the rates for by gender, male and female. And then this is one of the main reasons we are here today, to talk about lethal means. So as you can see in this, again, this is 2018 through 2022, our suicide rates are mostly firearms. And I'm going to talk a little bit about, I won't go in depth about the CALM training in the sense of why one thing is more lethal than the other. Really what I'm here to just talk about today is there is this new training available, and I want people to know what it is so that if you are, if you're interested, you can contact me and I can come to a training for your agency. And there's a couple of different kinds of trainings available. But as you can see here, almost 70% of suicides are completed by firearms. And then this little map down here is just our specific Wyoming data when it comes to suicide. And as you can see, Hot Springs is one of the highest, 67. And again, we have to think about, the population of Wyoming and the population of the counties. But as you can see, Carbon is right up there in the top with some of the other counties. Johnson County, Carbon County, and Platte County are some of our higher. And if I will share this presentation, but this website has some really good statistics if you're interested in really digging into. This map is really great. It's interactive. So like when you go over Carbon, it talks about some of the specific data around Carbon County and our residents here in Carbon County. And really, I just wanted to share this because our numbers do change, they fluctuate. Of course, we don't have the last 2 years of data, which we will probably have that data here in the next couple months. And I'll share that as always. But as you can see, this is the impact that suicide has on the community of Carbon County. So I'm going to go back to the presentation, and we can talk a little bit about what CALM is and why CALM. And so as we move through this presentation, maybe does it want? There we go. So CALM, it is a practical intervention to increase the time and distance between individuals at the risk of suicide, specifically lethal methods of suicide. There are other methods, and again, in the training, we talk in depth about those trainings and why that's important. But it also teaches why means matter. It equips individuals. And when I talk about CALM, it's counseling, conversations, and collaboration. So there is a 90-minute version of CALM, and that's typically what I would do with the community. And then there is a 4-hour one for counselors, and that is available. I cannot do that one. I am not a counselor, but it is available here in Albany County. We pay to have those, to have somebody trained in that. So we've got 3 trainers here in Albany County, and one of them is a counselor, and she is offering some of that online, and so I'll share that availability as well. So why means matter? Reducing access to lethal means can decrease the likelihood of suicide. Firearms and dangerous medications are our primary concerns. Those are the most lethal means. Address both in crisis, during an immediate crisis. And then, so as we move through this, there's a training for clinicians like I talked about, and that one is about 4 hours, like I said. It's for mental health clinicians, primary care providers, and crisis intervention services to enhance the skills in discussing and implementing safe storage. So really, this training is trying to get people to talk about the means around suicide. We always talk about the why. Why can people complete suicide? Why do people have suicidal ideation? Whether it's a life change or mental health, we're always talking about the why. We've discovered that talking about the how is just as important because it breaks down those barriers. Again, it's that stigma. We have to be able to talk about all aspects of suicide so that we can actually see change. So there's a training for non-clinicians also, and that is what I am able to do for the community. Community groups, suicide prevention coalitions, shooting clubs, parent groups, general public. I know here in Albany County, we'll be doing it with some of our gun safety classes, our hunter safety, things like that. Anywhere that, guns are sort of the center focus is also a great place to do it. And then this is really just to equip non-clinicians with knowledge to help individuals at risk of suicide. And just, again, giving general public the ability to talk about suicide and how people complete suicide. Collaboration, so the objective is to develop a culture of safety by bridging healthcare and gun-owning communities. Again, we love our guns in Wyoming. We don't want to talk about our guns in a way that are derogatory in any way, but this training really breaks that down so that we are giving people the knowledge around gun safety, gun storage, especially when somebody is in crisis. This will help us foster collaborations that will help with suicide prevention efforts. And again, for anybody, community groups, suicide prevention coalitions, shooting clubs, parent groups, anybody that we can collaborate with on these trainings and provide these trainings for their organizations. Again, it's just breaking down that stigma and having the conversation. Benefits of CALM for individuals, it keeps at-risk clients and loved ones safer by managing access for lethal means. For communities, it promotes a collaborative approach to suicide prevention and respecting individual rights and autonomy. Again, it promotes that it's comprehensive. And organizations will provide effective strategies to integrate into existing suicide prevention practices. For those of you that are part of the coalition, you know we always talk about how can we be more comprehensive in all of the prevention that we do. And this is just one more tool in our suicide prevention toolkit that we can use in our community. It's just another aspect of suicide that's really important for us to be talking about. It's really, and the best way to get involved is individual providers. You can sign up for CALM and get a hold of me, and we can do a CALM training. I can put you in contact if you are in the world of counseling, social work. You work really closely with clients. I would highly recommend you do the 4-hour CALM. I know that there's a couple of opportunities coming up online that you would be able to do that, and I will share that out with the coalition. I'm waiting for that information. I'm trying to get the Zoom information from my other trainer. She does it in 2 parts, so she does 2 virtual trainings. She does part 1 in a couple of hours and part 2 in a couple of hours, and she does them a couple weeks apart, but it is a nice option to do this virtually. You can always contact me, and I will put my contact information up at the end of the presentation. And then community groups, it's just another opportunity to explore prevention efforts. So any organization that would like this information, it's available to you. And I know that was very short, but again, CALM is something very new in our state. I think this training has been around only about 5 years across the country. It was created by a clinician who works for the JED Foundation. For those of you that don't know what the JED Foundation is, it's been around for about 25 years. A family created this foundation to work on suicide prevention on college campuses. And they've recently branched out into community structures. And what JED Foundation really wants to do, and their goal, even starting 25 years ago, is to take a look at the community and fill the gaps where there might be a need for more education, more tools to educate on suicide, tools to help people ask the question and have the conversation around suicide. They created the CALM training because it was just one more thing that we weren't really talking about. If you've ever taken a suicide prevention training, QPR is question, persuade, refer. That training is really being able to ask the question about, are you thinking of killing yourself? Those tough questions that nobody really wants to ask, but it's important that we ask the questions in a succinct way so that we can break down that stigma, but we don't talk about the how. If you have taken assist, you might get into the how with somebody or a client or a person that you're working with. It might come up in a scenario where you need to ask if you have a plan to complete suicide. That is why CALM goes in a little deeper around the means. And not only is it around firearms, it also talks a lot about medications. So the top 2 completion is fatal overdose and firearms, and then suffocation is the next one. And that one's definitely a little bit harder. Firearms and medications are the top 2, and there is a way to do safe storage for guns and medications. So that's why CALM is really addressing those top 2. We highly encourage conversations around all means of suicide, because I think, again, it's very important to talk about the means of completing suicide, just so we can break down that stigma. We don't want this to be a taboo subject anymore. We want to have the conversations about lethal means and people dying by suicide. So if we don't talk about the how, we're leaving out a big piece of that. Another part of CALM that is really, it's educating on safe storage. We do talk, again, we don't like to talk about our guns in Wyoming and taking them away, but we are trying to come up with solutions. If you have a family member that doesn't live with you, that would hold your guns until somebody is through the crisis period. Here in Laramie, we do have a safe storage option. It's called Hold My Guns. It's a nonprofit that's within a place that already stores guns, but they can store your gun if you're in a time of crisis, or store guns for a friend or a family member if you're in crisis. I know that in some communities, law enforcement has had to remove guns from a home. They don't love to do that. What we've learned from safe storage here in Albany County is that it's a huge liability. It's a liability across the board. And so as a whole, we're trying to figure out ways that we can provide safe storage. And if we think about our guns, we want to treat them with utmost respect. And so how do we find a place to store guns safely in our communities for people that are in crisis? We find that the CALM training goes in depth about the psychology behind suicide. It does talk a lot about most suicides are, some are planned out, but most of them, 65% of suicides are within 10 minutes of ideation. So that's a little bit new data. So taking away that impulse and being able to, even having guns in a locked safe that you actually have to take the time to unlock and open. We've heard some really creative strategies in other trainings. People put pictures of their kids or their grandkids, their loved ones in general, on their gun safe. People that, so that when they go to open their gun safe, they have to think about it. So anytime we can disrupt that moment of thought and disrupt, a plan, that's the whole goal of CALM, is to really talk about disrupting that plan, giving people moments to think about what they're doing. And one of the best ways is to not have guns in the home when somebody is in a crisis, or next is having to get into a safe and unlock it, things like that. So this training is, like I said, it's about 90 minutes, and we do talk a lot about collaborating in the community, having the conversations about guns and medications in our community. When it comes to medications in Carbon County, the hospital has deterra bags, and they do advertising around those. That's a way of discarding of unused medications, so there's not medications sitting around the house. And again, it's very similar to guns when we talk about safe storage for our medications. If they're stored in a safe or out of reach or out of sight, it interrupts that ideation moment. So that's really what this training is about, is having a conversation about how, so that we can disrupt that in the moments of crisis within our community and our families. And so, again, this is a very short conversation, but this is just one more training that is available here in Carbon County. My information is on the screen, and like I said, I'm a trainer. I have 2 other trainers here in Albany County that are very willing to travel. And this is a training that it does translate virtually a little better than some of our other suicide prevention trainings. And so if it's something that you would like to do, and we could set up a virtual aspect and do it that way, we would love to do trainings for as many people as we can. Again, QPR is a very simple, it would be great along with CALM. I would highly recommend that the community is versed in QPR and CALM. I mentioned ASSIST in this training. That is a 2-day training, and we highly recommend that for counselors, social workers, law enforcement, people that do see people in crisis, and maybe not on a regular basis, but enough that ASSIST really gives you that next level of information, so that you can that you know what to do, you know how to ask them if they're in trouble, and then be able to get them help. Whereas QPR and CALM, we're really starting those conversations. This is where we're starting. We're trying to break down stigma with these conversations. And so again, there is my contact information. If you ever have any questions about suicide prevention or prevention in general in Carbon County, you can reach out to me. But if your agency is interested in a CALM, please reach out at any time, and we can make that happen for you. Just think about suicide prevention this month as we move through September. There's going to be lots of advertising around suicide prevention and things we can do. And always remember that 988 is a talk and a text line. If you're a veteran, you can call 988 and then dial 1, and you will get somebody that can help our veterans more specifically in the 988 world. So 988 is a great resource. It's made a big difference. And again, it is local. We do have 2 call centers in Wyoming that take those calls. And so you are getting somebody in Wyoming when you call 988 or text 988. So if you have any questions or comments, please feel free to email me. And our Facebook page is on there also. We have a website coming soon, so look for some of those changes in our community. And one other thing that we're really trying to do in Carbon County is create what is called a Connect team. So one of our priorities is providing tools for suicide prevention in the community, but also resources when we do have a trauma within our community, and ways to help heal our community. Again, I'm Tracy Young. I am a community prevention specialist for Carbon County Prevention Network. We are an active coalition in Carbon County, both in Rawlins and in the Valley. Any questions? There's my information.
Tracy, we actually don't see your information. It's still on the Department of Health website. Do you want to put it up real quick?
No. That's interesting. So they didn't see any of my presentation.
No, this is where it stayed.
Okay, sorry. Let me see. There it is.
How interesting.
Yeah. So
great.
okay, so there is the contact information. Let me make sure we can see it. And